My name is Ricardo Castellini. I am a media educator and still a PhD candidate at Dublin City University. Um, and my research project investigates how the new digital media technologies can help promote media literacy in secondary students. So, so my field of studies is media literacy, which is a very broad field. And one of the topics that I study is exactly disinformation and fake news. So this is one of the things. And today with me, I have my colleague, Eileen Culloty. I'm gonna read her bio here. So Eileen is a postdoctoral researcher at the Institute for Future Media and Journalism at Dublin City University. As part of a new project, she leads research on countering online disinformation and is giving invited presentations on this topic to the OECD High-Level Risk Forum and the UN International Organization on Migration. A forthcoming book with Dr. Jane Suter on disinformation and manipulation in digital media is published by Routledge. And I'm really looking forward to reading this book. So it's really a privilege for us to have her here. She's an expert on the topic, and I'm really happy that she joined us. Just a very quick context on what we're doing. I'm gonna share here my screen with you. Um, So this media literacy series, we are doing this as part of a series to accompany an exhibition put together by Tactical Tech called the Glass Room Misinformation Edition. This exhibition is available online right now. You can find the link on the Dún Laoghaire Library's website. And this series will run for 6 weeks. So every week we'll have a different event. Every Monday we have a new educational video on media literacy. So the first video was uploaded 2 days ago. And every Monday we'll have a new one. And every Wednesday we'll have a different online event. So this is the first one. It's a webinar on disinformation and COVID-19. And then I'm going to have another webinar on the week 4 about data privacy and surveillance. And then we're going to have 4 workshops. And each workshop has a different topic. I just put the calendar there for you. But you can have access to this calendar on Dún Laoghaire Library website as well. As you have noticed, your video and your audio are turned off. But of course, you can participate. You can still participate using the chat. So if you have any comments and if you have any questions, please send these questions to us. Unfortunately, today we only have 1 hour, so we won't be able to answer all the questions. But I'm gonna select some questions, and we're gonna answer here. Okay. So I just want, so the topic today is disinformation. I hope the audio is good and the image is good. If you have any problems with this, also you can send a message to us. So the topic today is COVID-19 and disinformation. And I decided to start with this topic for kind of obvious reasons. I mean, we are going through very difficult times right now. With this pandemic. And one of the most important things that we need right now is to have good quality information, because we have to make decisions. And not only the governments have to make decisions, but we have to make some decisions in our lives. And it's important that we have very good and sound information in order to make these decisions. And as you know, disinformation is not a new topic. It's not something new for us. Actually, disinformation has been around probably since we invented language. What happened is that because of the internet and the new digital media technologies, nowadays it's much easier to both create and spread disinformation around. And this is problematic in every situation, in every context, but especially when we are going through a situation like this. I mean, a big pandemic. So it's very important that we have good quality information. And what makes this situation unique is that, first of all, is a global problem. So it's affecting everyone in every corner of the earth. Of course, that we also have other global problems like climate change, for example. But the way climate change affects us, is more slowly. And this pandemic actually came everything at the same time, and it's having a very strong effect on our lives. And the second thing is that it's something new, because it's a new disease, it's a new virus, and we are still learning how to deal with it. So this is the background of our conversation. Okay. You're gonna notice that I have to sip some water every now and then because my throat gets really dry. I apologize for that. So when we're going through this kind of situation, we need to have good information, and as I said, and who will provide this information for us? Well, we have governments, we have the media, we have international and transnational organizations such as the World Health Organization. And we have the scientific community, who are the specialists in this. And ideally, we should be talking about the same thing, and we all should be on the same page. But it's a little bit more complicated than that, because, as I said, everything is new. So, and here I'm not talking about fake news and disinformation yet. I'm just saying that it's very complex to organize information and provide information to people when you have a situation like this. The problem is that science is not magic. When you're talking about science, you have to rely basically on two things. The first thing is data, and the second thing is technology. If you have data but you don't have good technology to analyze it, it's no use. At the same time, if you have technology but you don't have access to data, or you don't have data at all, it's no use. So, and the situation we're going through now is in this second category. I'm sure you remember when the pandemic first came about. I mean, when we were aware of what was going on more seriously. This was when the pandemic broke out in northern Italy in about late February, early March. I'm sure you remember all those horrible scenes of filled up hospitals and trucks carrying corpses out of the city, people in lockdown. And the data that we had at the time, it was that, it was what they called a mildly deadly virus. I know I hate this sentence, but that's the way they put it. So it was a mildly deadly virus because it was not as deadly as Ebola, for example. But it was a virus that spread really quickly, right? So, and what do you do in this kind of situation when you have a virus that is spread really quickly? Well, a lot of people will be infected at the same time. And you're going to have a percentage of people who will need to be hospitalized. And what's going to happen is the health system will collapse because there will not have enough beds, enough ventilators, enough equipment for everyone. So what do you do in this situation? Well, you don't have vaccine, you don't have medicine. According to the specialists who were the infectologists, they said, well, there are two things that we have to do. The first one is personal hygiene. So we have to wash our hands and keep everything clean. And we have to keep distance from people. That's the only way. When you don't have medicine, you don't have vaccine, that's the only way to prevent the virus from spreading. So this idea began to spread all over the world. Okay, so governments began to apply quarantine and lockdowns in countries. Other governments decided to do things in a different way, like Sweden, for example. And some other governments also decided to minimize the situation. And I'm sure you know at least one of the governments I'm talking about. I have here two examples of this. The first one is Donald Trump. The second one is Jair Bolsonaro in Brazil. I'm going to share a video with you. Just give me a second. Just a technical issue here. It's gonna work.
Now, the virus that we're talking about having to do, you know, a lot of people think that goes away in April with the heat. Because of all we've done, the risk to the American people remains very low. People die from the flu, and this is very unusual. And it is a little bit different, but in some ways it's easier, and in some ways it's a little bit tougher. But we have it so well under control. I mean, view this the same as the flu. When somebody sneezes, I mean, I try and bail out as much as possible. It's going to disappear. One day, it's like a miracle. It will disappear. Now the Democrats are politicizing the coronavirus. And this is their new hoax. If you're healthy, you will probably go through a process and you'll be fine.
No particular, pelo meu histórico de atleta, caso fosse contaminado pelo vírus, não precisaria me preocupar. Nada sentiria ou seria, quando muito, acometido de uma gripezinha ou resfriadinho. Grande parte dos meios de comunicação foram na contramão. Espalharam exatamente a sensação de pavor. O sustento das famílias deve ser preservado. Devemos, sim, voltar à normalidade. Algumas poucas autoridades, estaduais e municipais, devem abandonar o conceito de terra arrasada, a proibição de transportes, o fechamento de comércio e o confinamento.
So yeah. So and these claims were based on what? I mean, were based basically nothing. I remember Jair Bolsonaro, by the end of March, he said that he believed, according to his belief, he believed that there would be around 4,000 to 5,000 deaths in Brazil during the pandemic. And when I checked the numbers the last time, in Brazil, there have been around 155,000 deaths. So he got it wrong for a little bit. So the pandemic started to become politicized. You know, many people, instead of going to reliable sources and checking for information in websites of the World Health Organization, for example, they started following their leaders. And this, as I said, I mean, it was not a big problem in the majority of countries because most governments were following what the World Health Organization was saying. But some countries did not, I mean, and they started saying that the World Health Organization didn't know what they were doing. And here I think it happened something very interesting because some people simply don't understand how science works, right? As I said, science has to rely mainly on two things, on data and technology. And the data set that we had in the beginning of the pandemic, in late February, early March, was completely different from the data set that we have today. So of course that we've learned a lot over the course of the last 7 months. And this is how science works, because some people were saying, well, but the World Health Organization was saying some things in the beginning and now they changed what they are saying. Yes, because that's the way science works. If I am a scientist and I say something today and in 2 weeks' time, another scientist proved that I'm wrong, I have to admit I'm wrong. I cannot just say, no, it's my conviction and I'm going to continue with that. That's not how it works. So the vast majority of what the World Health Organization was saying in the beginning, they continue to say right now, but just some things changed. Um, but the thing is that some governments took this opportunity and started saying things like, well, the World Health Organization is in collusion with China because they want to hide the causes and consequences of the pandemic, and so on. And another issue that I want to point here is that because we knew from the beginning that vaccines would take probably a long time to come out, a lot of people were looking for some medicine, something that we have now, and that could help us to prevent the spread of the virus, or at least give us some relief. And there was a lot, still there are a lot of tests and studies on that. And I'm sure you've heard about hydroxychloroquine. This is one of the most famous medicines. And here, if you go to the World Health Organization website, here's what they have. I'm gonna share my screen again. So
Now, the virus.
So here's the information on the website. So fact studies show hydroxychloroquine do not have benefits in treating COVID-19. And here's Jair Bolsonaro with hydroxychloroquine. So he spent like 4 or 5 months saying that he had found a cure for coronavirus, when we actually know that this is not the case. And here I'm not saying that hydroxychloroquine does not work. We actually don't know whether or not it's work. Apparently it doesn't work, but there are still tests going on to show that. So here we have the beginning of a lot of disinformation about that. And I think that, it's absolutely normal that we feel a little bit lost, because the amount of information that we've been receiving is overwhelming. It's as I said, it's a new disease. We are still discussing a lot of things like, we have to wear masks or we don't have to wear masks. We have to keep schools closed or we have to open schools. We have to be 1 meter away or 2 meters away from people. So there's a lot of things going on. Now, beyond this, the problem is that there's been a lot of information that has been fabricated in order to cause confusion, in order to manipulate people. And this is done, this is different from misinformation, which is when you spread some information that is false, but you're doing this not because you want to do it, you're doing it accidentally. But there are a lot of people actually creating and producing information which is false and is spreading, especially online. And the internet and the social media platforms, they are very fertile terrain for this kind of things, especially conspiracy theories. I have a list here just to mention a few of them. So we have some stories about that China created the virus in a lab to destabilize Western countries. Vaccines don't work and cause autism, or they come with a chip inside that's going to manipulate your brain. Um, uh, some disinformation about miraculous cures. Viruses do not exist. The World Health Organization is working for China. Lockdowns have been imposed to control and manipulate people. 5G spread the virus, and so on. And sometimes we dismiss these stories as just ridiculous stories, and we say, "Oh, this is not true. This is nobody's going to believe that." Well, people do believe in that. I know some people who believe that. I have people in my family who believe in some of these stories. I have actually friends who believe in these stories. So this is a very serious thing, because again, we are going through very difficult times. A lot of people are dying, a lot of people are getting sick, a lot of people are losing their family members. And it's not only that, there's a lot of things involving mental health. People are losing jobs, businesses are closing down, borders have been closed. So we need to be very careful about these stories. So I'm gonna ask Eileen to continue from here. She's gonna share some of these stories and discuss some of them with us.
Great, thank you. So hello everyone, my name is Eileen Culloty. I'm a researcher at the DCU Institute for Future Media and Journalism. And I was really delighted to accept this invitation because Dún Laoghaire libraries are my local libraries and I know they do so much great work in the community. So I've prepared some slides that hopefully I'll be able to share easily now. So are you able to see those okay? Yeah, perfect. So as just quick outline, so first I'm going to talk a little bit, pick up some of the points that Ricardo has raised there about how we can understand disinformation, and then focusing on COVID-19 in particular, why it generated so much disinformation, why people believed and shared it, and then focus on three key ones in particular: the 5G, the vaccines, and the anti-mask protests, of which we've heard so much about recently. And then finally, I'll very quickly mention what the latest research says about how to counter disinformation and how to make sure that people can be resilient to it. So disinformation is as old as time, exactly as Ricardo said earlier. There have always been people that want to dupe the public and deceive them and to scam people. So none of this is new, those types of negative motivations. But what is new is the ease with which you can do it and the amount of people that you can reach. So if you think about it, even 30 years ago, if you wanted to imitate a BBC News report, how would you even go about doing that? You would need to have cameras, you would need a studio. The chances of you successfully imitating BBC News is extremely slim because you wouldn't have the resources or the ability. Now, all you have to do is take the logo of the BBC, put it onto some content, and you can do this without any sophisticated technologies. You could do it in PowerPoint, you could do it on your mobile phone. And we've seen this throughout COVID, for example. People took the Twitter account of Laoghaire-Rathdown, put false text underneath it, and then shared it. It is really, really easy to do. And so this has a massive knock-on impact on trust, because many of us have grown up with particular media that we trust, or we just see the logo for a particular news outlet, and we assume, maybe I don't fully believe or everything that news outlet says, but if it's being reported there, well, there must be some truth in it. And now we're in an environment where you can't really trust any of those normal indicators. And so another huge factor in this, of course, is the social networks and the messaging apps. So whether it's WhatsApp, Facebook groups, Twitter, and so on. Because if you're on one of these platforms, you're inundated constantly with messages. And unlike, say, previous media where you knew that at 9 o'clock you were turning on the news, or at 7 o'clock in the morning you were turning on Morning Ireland to hear a current affairs program, and then another time you would turn on an entertainment program. On these platforms, all different kinds of content are mixed together. So you get a piece of news followed by a piece of gossip, followed by an update on someone you know who's done something interesting, and it's all mixed together. And that's really confusing for us to process and deal with. And it's also very new to us. We've only been living with this type of technology for a decade or so. And it's called the attention economy because it rests on a very basic disparity. There's a huge volume of information, and we have very little time to devote to that information. So often what we're doing is just skimming content, scrolling through, and not giving anything our full attention. So we're only processing the gist of something. And the gist might be, I saw the logo of BBC News and there was an outrageous claim or something alarming about COVID-19 after it. And it seemed true, but you didn't fully read it or check it out. And that's why disinformation is destructive. And we often talk about people being duped or fooled. I don't particularly like that type of language because it implies that people are somehow deficient. There's nothing deficient about people who are duped or fooled because they weren't paying full attention to it, when the whole system is not designed for you to be able to process it clearly. So one way we can think about disinformation, and specifically online disinformation, is to break it down into different actors and different stages. So on the one hand, we have what are called bad actors, and they're called bad actors because they intentionally create false content. And this intentional part is key. They're deliberately trying to trick other people, to deceive people, to manipulate people. And they can do this using digital media platforms in particular. So we call these enabling channels because they make it very easy to spread content, and they can do it at great scale. So I guess another massive difference from the mass media that many of us grew up with is that even in the early 90s, it took time for a news story to travel from the US to Dublin or to China. You know, there was a delay there. It had to go through processes, mostly through journalists. And now something can instantly travel around the world. So the ability to reach a massive audience almost immediately, and to do so while using fake logos and fake content is quite incredible. But an awful lot of disinformation is created and it doesn't go anywhere. So much, and perhaps many of you have come across this before, you see something, you think that's not true, and you just ignore it. The problem is when audiences respond and they do start sharing it. So I would say that audiences are the most important component of this entire process, because if the audiences don't believe a story or share a story and pass it on to their own peers, well, then the disinformation doesn't have impact. But once it starts spreading among peers, it has a real impact. So if you think about it, the bad actor, so this person who creates the disinformation in the first place, let's say, for example, they are a conspiracy theorist that believe that 5G masks are a cause of COVID-19. So maybe you wouldn't give much credibility to that person if you met them. But if one of your friends or neighbors or family members is the one passing the content on to you and saying, you should pay attention to this 5G story, then you're more likely to give it credence because someone you know, care about, and trust has shared it with you. So in the work we do, we focus a lot on audiences and how we can help audiences recognize disinformation and, crucially, help them see that they really shouldn't share it in the first place. So, as I said, this idea that people are just duped and fooled is quite a destructive one because it doesn't give people much credit. And in a lot of news reporting and disinformation, that's unfortunately common, as though there's this mass of people who are just very ignorant or not smart enough to understand that a story isn't false. But what the research finds is that a lot of people are quite aware when they're engaging with disinformation that it might not be true. And when they're asked, why did you share that? Or why did you like it or pass it on to somebody else? The reasons they give are almost always very positive social reasons. So they want to inform somebody else that something is happening. And they might not think it's true, or they want to warn them about a potential danger. So to give you one example, vaccines is a huge area where there's an awful lot of disinformation and rumors and myths about the safety of vaccines. But somebody who's passing that on, say to a parent who's about to vaccinate a child, they're not necessarily intending to cause any harm. They're just thinking, well, my friend or my neighbor is about to vaccinate their child. If this alarming story is true, then they should know about that. That's a very different thing to actually believing it and trying to persuade somebody don't take a vaccine. And finally, many people just find disinformation entertaining. I don't know if you remember the by now quite famous story that claimed that Pope Francis endorsed Donald Trump for the 2016 presidential election. Studies were done on who shared that story, and it was mostly Democrats, and it was mostly people laughing at it because they thought it was just completely stupid, and it was obviously not true. So there are an awful lot of reasons for why people share disinformation, and none of them necessarily imply that people believe it or that they have bad intentions towards other people. So then if we think about COVID-19 specifically, and as Ricardo very clearly outlined, it was this period of intense scientific uncertainty. And we know from historical research and on previous scientific topics that when there's scientific uncertainty, people tend to distrust science and they will look elsewhere for answers. So people wanted answers about what exactly has caused this. When will it end? I think was probably the biggest answer people wanted. When will we have a vaccine? What are the exact measures we should be taking? And the scientific community wasn't able to give us those answers because it was new and they had to research it. And importantly, the scientific community were also disagreeing with each other, and we're still hearing those disagreements about what the best preventative measures are, whether lockdowns are effective, and so on. And when there's scientific uncertainty, people tend to distrust science and tend to look for alternative explanations. So this was one very big factor that explains why there was so much disinformation at the beginning. A second factor is just the simple catastrophe that we all found ourselves, quite a phenomenal experience for the world to be put into this period of great social and psychological upheaval. And again, historical research shows that when there is this a very great psychological upheaval, conspiracy theories tend to flourish. And conspiracy theories offer ready-made solutions. So if you have a question, why did this happen? Explain why this terrible calamity is happening in the world. The conspiracy theory comes in and gives you a very simple, clear, wrong, of course, but a very simple, clear explanation, something that you can grab onto. And so in our work at the Institute, when we looked in the period from March into April at the types of false claims that were being shared online, it was incredibly diverse. And some of it was clearly intentionally out to deceive people, like scams. And others was, again, it seemed more honest and genuine. So advice about healthcare. It was incorrect advice, but it didn't seem like it was intentionally trying to harm other people. And that's why disinformation is quite a complicated topic, because it's obviously very controversial to accuse someone or some organization of producing disinformation. And it can be very hard to ascertain at what point does it become deliberately manipulative. So just to look at some of the topics that or the themes and types of disinformation we came across, rumors was probably the most dominant one in the early days or the early weeks. So a lot of rumors about cases, about the types of symptoms people were showing, about health advice, home cures, and things like that. Then hoaxes about policy measures. So there were a lot of hoaxes saying that the people coming back from Cheltenham were going to be put into quarantine. I suspect that one was put out there by someone who wasn't able to go to Cheltenham and was very jealous of his friends being there. Hoaxes about an imminent lockdown. Scams were very much targeted at older people, so very opportunistically targeting older people, asking for bank details, using the logos of the WHO and banks and so on. Then the conspiracy theories, which I mentioned some of, and I'll look at some more of those in a moment. And then political propaganda. In March and into April, you had different countries pursuing different paths, so different responses to the crisis, and accusing each other of being bad actors. So China accused the US of creating the virus. The US accused China of creating the virus, so feeding into conspiracy theories. And then countries also accused each other of not doing enough to support each other. So Russia said the EU wasn't helping European countries and so on. And then finally, just lots of inaccurate opinions. It seemed like everyone overnight became an expert in epidemiology and how you read charts and statistics. And there's no suggestion that people were deliberately trying to confuse anyone else. They're just giving their opinion. But the culmination of all of this, on top of the endless news reports, very scary coverage about what might be coming down the line for us, the essence of all of this is it created this infodemic. This is a word the WHO coined. And the meaning of infodemic is not just that there's lots of disinformation, it's that there's too much information, full stop. There's too much accurate information, false information, and everything in between. And because it's all coexisting together, it's really difficult for people to sort out What should I trust? What do I need to know versus what's not reliable at all? And if you remember the slide I had on the attention economy and this idea that it's extremely difficult for us to process huge volumes of information, COVID-19 made all of that much, much worse. So it was just a very, very confusing time, particularly back in March into April. So at that period, we were doing some work in our institute with Age Action for a separate project, and they had mentioned that they were getting a lot of calls from older people and people who work with older people saying that they were just inundated with false information. So if you remember that older people were, first of all, more vulnerable to the disease, they were being asked to cocoon. Family members often were not visiting them because it wasn't clear how the virus spread. And then many were on digital technology, so they got phones and tablets to stay in contact with people and joined WhatsApp groups and so on, but they wouldn't necessarily have been using these for very long and didn't have the digital skills maybe or the familiarity with the technology. So they were being inundated with these scams and rumors and messages. So one of the things we did was create a resource as part of the Age Action Getting Started kit, and it was specifically targeted at helping people avoid false information about COVID. So these are just two screenshots from that. And the point was really simple. It was first to reinforce reliable information. So the very first thing we did was not talk about disinformation at all, was to just list, these are the reliable information sources in Ireland. These are the places you should check to find out information. And if you're not able to access these things online, listen to national news, listen to your local radio news, whatever it is, these are the places you get good information. Then basic advice is to look at the source. Do you recognize this source? If you don't recognize the source, then maybe you shouldn't worry about it. If you want to find out more, look at reliable sources. So a simple thing to do in Ireland is look at RTE News, listen to your local radio news. If anything important has happened nationally, it will be reported there. And then finally, you can ask someone you trust if you're still unsure. And my own mother-in-law was just joined WhatsApp at this point, and as did my own mother. And it was just crazy, the kinds of messages they were forwarding to me saying, this terrible thing has happened. And they were all just fake online videos, but generating huge amounts of anxiety because they didn't know whether they could trust them or not. Then towards the end of the document, so after we had emphasized the reliable sources, how you check sources yourself, then we explain about rumors and hoaxes and the different kinds of content. What we try to very much avoid doing is repeating false claims, because there is no point repeating the incorrect information. It's far more important to emphasize correct information. So we had a series of 6 of these short tables that explained the type of content they might be seeing. So rumors often say, oh, a friend works in a hospital and he heard this. That, ask yourself a simple question. Is this based on official facts or is it based on hearsay? If it's based on hearsay, you can ignore it. These are just simple rules of thumb. So moving on from that, then just talk about 3 of the very big topics that have animated COVID-19 disinformation worldwide. So the first was the 5G. And from a very academic point of view, I thought this was really interesting because 2 things overlapped together. The rollout of the 5G networks just coincided with COVID-19 hitting Europe and North America. These new technologies like 5G, every time they're rolled out, they tend to attract conspiracy theories for a period of time. So there are these committed conspiracy theorists who are pushing the content. It will hit the mainstream and people will be worried about this new technology for a while, and then it levels off. With a very similar pattern was evident if you remember the introduction of microwave ovens, where people were quite worried about radiation and whether they would cause cancer. Or in the late 90s, early 2000s, when smartphones and mobile phones, not smartphones, became mainstream, there was this huge concern that they would lead to fertility problems and again cause cancer. And that very quickly died away after initial spike in concern. 5G was following this same pattern, but then it coincided with COVID-19, and this led to a massive spike in interest. And for a core group of people, it hasn't gone away. It is still quite a strong belief, and there's a strong movement saying that COVID-19 is a test case for the rollout of 5G and mind control technologies and so on. A key part in sending this mainstream was that a lot of celebrities promoted the claims. They didn't necessarily endorse them. They just said, oh, maybe we should look into 5G. And what's important here, I think, is that point about the common pattern, because once people can recognize common patterns in conspiracy theories, they're far more likely to be able to reject them. Because back in March, when we were in this very crazy period, it didn't seem entirely insane for someone to say, maybe it's connected to this new technology. The whole thing seemed crazy in the first place. So it's about not demonizing people for indulging in conspiracy beliefs, but trying to understand how they have been taken in. And that's the best way then to try and help people come back out from it. So after the 5G, I think vaccines were the next big topic that was driving online disinformation around COVID. Anti-vaccine disinformation is not new at all. This is a very highly mobilized online campaign, and it has massive impacts across the world. So in Ireland, we've already experienced a decline in vaccine uptake, which has resulted in outbreaks of preventable diseases like measles. This has been happening for a number of years now. The online movement is quite well financed. They produce very sophisticated materials and very clever rhetoric. So nobody says that they're anti-vaccine. They'll say they're in favor of vaccine choice. And this language of choice and freedom is very strong in COVID-19 disinformation. So some of you may or you may not have come across an online conspiracy documentary called Plandemic. So very sophisticated production that claimed that the CDC, the American Center for Disease Control, was organizing COVID-19 or exploiting COVID-19 to roll out mandatory vaccinations. And this is a key battleground for the anti-vaccine movement, because they oppose mandatory vaccinations, and their concern is that if our best way out of COVID-19 is vaccination, they don't want to establish a precedent of mandatory vaccinations. If you're interested in more about conspiracy theories, there's an excellent online resource by Cook, where he focused on this documentary specifically and explains how it fits the pattern of conspiracy thinking, and how you can use that to talk to other people that might have started espousing conspiracy-like beliefs, to try and help them see why it is conspiratorial. And then finally, I think the more recent manifestation are the anti-mask protests. And like vaccines, these didn't come out of nowhere. They were building on previous movements. So the yellow vest movements, for example, that were well established in Europe, not so much in Ireland. So the previous yellow vest type protests in Ireland were not attracting many people at all. And then as the summer was moving on, and there was just great frustration with COVID-19 restrictions, lots more people were turning up to these groups or to these protests. It's important to note, though, that these anti-mask protests attract a very wide, diverse group of people. So I'm certainly not saying that everyone who attends them is affiliated to the far right. That is not the case at all. But they do have very strong links, the organizers of these protests, to far right movements and to far right extremism. And again, like vaccines, you hear a lot of the rhetoric of freedom and rights. It's not a rhetoric that we're very familiar with in Ireland or most of Europe, I would say. It's a very libertarian American type rhetoric of where individual liberty trumps everything. And of course, that riles directly against the type of situation we're in, where we all need to act for a collective good rather than our own individual interests. So finally, just to come back to this idea of how you counter disinformation. So the examples I've shown you, and COVID-19 in particular, highlights that bad actors or manipulation actors are highly opportunistic. So they will just capitalize on whatever opportunity comes their way. And they will tie their own agenda, whether it's vaccines or a far right agenda, to whatever is topical. But research shows that people can be made resilient against these manipulation strategies. And some of the things that work are incredibly simple. So the first is simply, it's called accuracy priming. That makes it sound quite complicated, but all that is asking somebody to pause and say, do you really think that's true? So when people are asked to just stop for a minute or less and say, is this plausible? Is this credible? They're far more likely to reject false claims. A related idea is called inoculation. And this is that if we can explain to people how manipulation works, what are common strategies used? You explain to people that bad actors will often try and make you angry and fearful. They're manipulating your emotions. Or that conspiracy theories are often trying to give you very simplistic explanations for very complex events. Then people are able to recognize those strategies and reject them. A caveat, of course, is that we need to do a lot more research. I'm a researcher, so I always will say that we need to do a lot more research, but there's a consensus that these two approaches, combined with media literacy and the type of work that Ricardo does, could go a really long way to helping people be more resilient against disinformation. So that is the end of my presentation, and I'm happy to have any discussion or answer any questions that you have.
Thank you very much, Eileen. That was very interesting, and here you're back. And what I think was, I really enjoy when you said that the focus. Let me see if I'm not sure people are seeing me here. Because you said the focus is on the audience right now. And one of the things that I think was problematic in the media literacy field is that for so many years, especially after the disinformation age, a lot of people were focusing on the technology itself. So people were talking a lot about how the internet works and how the new digital media technology works, the social media platforms work, but we forgot to talk about people, like, and as you said, it's not a matter of saying, oh, that person is stupid because they believed in something that's so ridiculous. It's not like that. I know a lot of well-educated people that believe in things that you go like, well, but how this is possible? So I think it's a combination, it's a balance between talking about the technology, of course, but also trying to understand people's minds and how we behave and how we react to information and so on. I actually have a question for you about the news industry. You know that the journalists have been under attack recently from many sides. What do you think is the role of journalism in this new situation now of disinformation, and especially during the pandemic? And how do you think the media, the news industry especially, have been reacted to that? I mean, how they provide the information about, good sources and how we should behave and the things that we should do?
Well, COVID-19 created a separate set of challenges for the news industry. So it's no secret that the news industry has been struggling hugely in the digital environment. So their revenues have declined massively. And then when COVID-19 hit, there paradoxically was a big increase in consumption of traditional media. So national radio, television, physical newspapers, but the advertising industry there was no advertising. So they were making even less money than they normally would while they had more readers. So long term, if we need independent investigative journalism, the vital role in democracy, there's a big question about how we can fund it. Separate to that, a lot of the the bad actors, so the conspiracy theorists, the disinformation actors, including some some global politicians, they attack and undermine news media all the time. So there are a huge amount of challenges there. In terms of how they covered COVID-19, I think a lot of great work was done in providing the public with accurate information, but scientific topics are not the forte of most journalists. Science journalism is quite a specialized area. So there was a lot of confusion if you were a journalist, you are not a scientific expert. There are different people making different claims. Scientists are producing contradictory reports. I think that's quite a tricky one for journalists to navigate. At various points, I think when Leo Varadkar was Taoiseach, he recommended, or Taoiseach, he recommended that people not watch too much news, not consume too much of it, because there was also a concern that this unrelenting negative coverage would just be too much for people. So there was an advice to tune in at select points, get your accurate information, but don't overindulge in all of the details.
Okay, thank you. Well, I was checking here the chat. Apparently, there's no questions coming. Okay, so I want just to finish up. I just want to say that I think the main point of this webinar, apart from everything that you said, thank you very much. It was really good. I think that we, in order to avoid being deceived by disinformation, there's a lot of things that we have to do. It's really complex. During this series, this media literacy series, we'll be talking about all of them actually in all the educational videos and also in the workshops. But I think the main thing, I mean, basically talking about this, we could say that we have to be very careful with the sources that we have. I'm going to show here, I'm going to share my screen again. This is the websites of the World Health Organization. They have a page called Mythbusters. So basically, you know how to report misinformation. There's a lot of information, about all these items here. And where was that? Here's the study I showed about hydroxychloroquine. They teach you if you are, for example, on YouTube or Facebook, how can you report fake information? So I think it's a very interesting website. Let me see if I can go to another one here. And also, you can go to HGC websites. There's also a lot of information in there. So try to avoid information that you find on social media platforms. Actually, Eileen participated in a very recent report about that young adults in Ireland are increasingly consuming news from social media platforms, especially Facebook. I think, if I'm not wrong, 46% of young adults from 18 to 24 years old are consuming now news from social media platforms. And this is very worrying. Information through WhatsApp. Eileen also mentioned the study they did with WhatsApp, and WhatsApp is even more problematic because you are receiving information from family members, from friends, from people that you trust. So you think, well, I think, my father would not share with me something that is wrong, so I'm going to believe in that. So this is very worrying and very dangerous. So sources of information are very important. Second thing is, science is not perfect. We know that, but it's the best that we have. It's the best tool that we have to measure reality and to understand the world around us. So if you hear anything about saying about the World Health Organization, because they said something in the beginning, they are changing what they're saying now. This is not something bad. This is actually something good. That's how science works. Because for scientists, if you they don't work with convictions, they work with data. So if the data changes, they're going to change what they're saying as well. And another thing that I think it's important is, don't forget about our own problems, our own weaknesses, like our confirmation bias, for instance. Remember that we have this desire, this inclination to believe in information that confirms our previous beliefs. So every time you encounter information, you have to reflect on that and say, why I'm believing in this. Is this really truth, or I'm believing in this because for some reason this does something good for me? So I think it's important as well. I would like, let me see if somebody has something to say here. Uh, I would like to say thank you to Eileen. I'm really looking forward to reading your new book. When is your book out?
Oh, it's either December or January, so probably January.
Great, great. I'm really looking forward to that. Thank you very much for participating. Thank you, Erica, as well from Dunleary Library, for the help. Thank you for everyone who participated. Don't forget to go to the library's website and check the calendar for the next events. And stay safe. Bye bye, everyone.
Bye, everyone.